Well, Canada is struggling with a shortage of foster caregivers. And now children's aid groups are banding together in a call to action as the situation deteriorates. Right across the country, more than 61,000 children receive out-of-home care. And every single one of them relies on a caregiver to take them in. But with resources stretched thin, children's aid societies and Indigenous well-being agencies are being forced to make a united call for help. Joining us this morning is Nancy Anson-Danquah. She's the Chief Operating Officer at Children's Aid Society, and Sandra Davis, who is a foster caregiver. Good morning. Welcome to both of you.
Good morning.
Nancy, I want to start with you. Why are we seeing this decline in caregivers?
So it's for a number of reasons. We have a number of foster caregivers who are reaching retirement age, and so they've fostered for many, many years and have decided to end their foster caregiving and move on to other things. And then also life transition. So people have fostered for a period of time and have been in service in that way and have decided to move on to other things.
Why are we not seeing new or younger families picking up this call?
So, there are sometimes some myths and misconceptions about foster caregiving and the types of families and individuals who we would want to seek to foster. So some people think that you need to own your own home or that you can't live in an apartment, and that is not the case. We really want to have people foster who live in different types of settings. Mm-hmm. And also people think that if you're single, you can't foster, and that also is not the case.
Somebody who can help us bust some of those myths is Sandra. Sandra, you have fostered more than 100 children in your course of about 23 years. So tell us, what is a typical experience like? Or is there such a thing as a typical experience?
There isn't a typical experience. We get a phone call from the placement and they're asking you, can you use your bed for this baby, this preschooler, this teenager? And that child comes with their unique experience, and they're asking you to bring that child into your home, meet their basic needs, but also provide them with love, support, guidance, get them to their appointments, and then hopefully transition them back to their home or transition them onto a permanent placement, whether that's adoption or kin. So there isn't anything that you can say, this is how it's going to go.
Right, because every child is different.
Every child is different.
And every child is coming with different circumstances. I want to ask you, because you've been doing this for over 2 decades, I imagine the first time you picked up the phone and said yes to bringing someone into your home, you either were nervous or had questions. How do you feel 2 decades on and 100 kids later about your experience as a caregiver?
It's more difficult now because the children that are coming into care now are children that have multiple needs. Mm-hmm. So when the phone call comes, there's a lot more that goes through your mind in terms of, will I be able to provide the care that this child needs? Will I be able to access the support that this child needs? Is this child going to need mental health supports? Is this child going to need medical supports? Is this child going to need tutoring supports? Mm-hmm. All of those kinds of things. Yeah. So it's actually harder now than it was 23 years ago when I started this journey.
You've worked with so many kids, Sandra. What are some of the moments that stand out to you that make you feel in your heart, I'm so glad I said yes?
It's when I get a phone call from one of, because when I first started, I did primarily teenage girls. Oh, so when I get a phone call from one of them that says, hi, Mom, I'm getting married. Mm-hmm. Hi, Mom, I'm having a baby. Hi, Mom, I just graduated with my master's, and this, I want you to come to the graduation. Those are the great moments that kind of make you feel like you made a difference. It's when you open the door for the first time to an adoptive family and you hand them their child, and you get a phone call from them on that child's birthday, and they want to invite you to their child's birthday party. Those are the moments where you feel like you've made a difference.
Oh, Sandra, I can see the emotion still, even now, on your face, just thinking about each of those moments. Yeah. Nancy, I'm going to end with you. What are some of the biggest concerns that you have right now around this growing shortage of people like Sandra in the system?
Yeah, so we want to make sure that we have many more people like Sandra to continue to be foster caregivers, and caregivers that can meet the diverse needs of the children and youth in our care. The children and youth in our care are as diverse as the population of the GTA, and so we really want to make sure that we can attract and garner interest from people in the city to reach out and reach out to their local child welfare agency to get more information, and they can do that by going to gta.theretocare.ca to learn more about the campaign, and as well to connect with their local child welfare agency to learn more about fostering.
Listen, Nancy, Sandra, thank you for coming on today. There are children out there who are right now in need of caregivers, but there are people out there I know who have been thinking about it, and now is the time to act. Thank you so much for being here today.
Thank you for having us.
All right. If you liked that video, make sure to subscribe to the Your Morning YouTube feed, where you can find all kinds of new content posted every weekday morning.